If you're over 60 and you take medication every single day, and most of us do, then what I'm about to share with you could be one of the most important things you hear all year. I want you to stop what you're doing for just a moment and really listen, because this is not just another health video. This is a conversation that your doctor may never have had with you, and the information in it could be protecting something you absolutely cannot afford to lose: your kidneys. Here's something that most people don't realize. Your kidneys are two of the hardest working organs in your entire body. Every single minute, minute after minute, all day long, they filter about half a cup of blood, removing waste, balancing fluids, and keeping your body chemistry in perfect order. But here's the frightening truth that a major study published in the Journal of the American Society of Nephrology found back in 2020. Kidney disease now affects more than 1 in 7 American adults, and seniors over the age of 60 are at dramatically higher risk. And one of the biggest hidden causes? The very pills sitting in your medicine cabinet right now. That's right. Some of the most commonly taken medications, the ones prescribed by doctors, the ones sold right over the counter, the ones you may have been taking for years, can quietly and steadily damage your kidneys without giving you any obvious warning signs until it's too late. The scary part is that kidney damage is often silent. You might feel completely fine while harm is being done beneath the surface. So today, we're going to walk through 5 specific types of pills that nephrologists, that's doctors who specialize in kidney health, are now warning seniors about. And more importantly, we're going to give you 3 simple practical solutions you can start using today to protect yourself. Stay with me all the way to the end, because the 3rd solution especially is one that most people completely overlook, and it just might be the most powerful one of all. Let's start with something you've almost certainly taken before, maybe even last week. We're talking about over-the-counter pain relievers like ibuprofen, naproxen, and aspirin, known medically as NSAIDs, or non-steroidal anti-inflammatory drugs. These medications are sold everywhere: your local pharmacy, the grocery store, even the gas station. And millions of people take them every day for headaches, arthritis, back pain, and general aches. They seem completely harmless, don't they? After all, if they were dangerous, you'd need a prescription, right? Well, not necessarily, and that's exactly what makes them so deceptive. Here's what's happening inside your body when you take these pills. Your kidneys rely on a delicate balance of blood flow and chemical signals to do their job properly. NSAIDs work by blocking certain natural chemicals in your body called prostaglandins, which are responsible for pain and inflammation. But here's the problem. Those same prostaglandins also help regulate the blood flow to your kidneys. When you block them, you're essentially cutting off some of the blood supply your kidneys depend on. In the short term, a healthy young body can handle this. But if you're over 60, your kidney function has already naturally declined. That's just normal aging. And your kidneys simply cannot bounce back from this kind of stress the way they once could. A landmark study published in 2019 by researchers at the University of Nottingham followed hundreds of thousands of patients and found that regular use of NSAIDs significantly increased the risk of acute kidney injury, even in people who had no previous kidney problems. And regular use didn't mean taking them every day for years. Even short-term frequent use was enough to cause measurable damage. For seniors already dealing with high blood pressure, diabetes, or heart disease, which many of us are, the danger is even more pronounced. These conditions already put extra strain on the kidneys, and adding NSAIDs into the mix is like pouring gasoline on a smoldering fire. What makes this especially troubling is that the damage often happens without any symptoms at all. You won't feel your kidneys struggling. You won't notice anything different in your day-to-day life, at least not right away. By the time symptoms do appear, such as swelling in your legs, changes in your urine, or extreme fatigue, significant kidney damage may have already occurred. That's not meant to scare you. It's meant to wake you up, because knowledge is the most powerful medicine there is. So if you're currently reaching for ibuprofen or naproxen every time you feel a twinge of pain, please talk to your doctor about safer alternatives that won't put your kidneys at risk. Your pain is real, and it deserves to be treated, just not at the cost of 2 organs you cannot live without. Now let's move on to a category of drug that has become almost as common as vitamins in medicine cabinets across the country: proton pump inhibitors, or PPIs. You probably know them by their brand names: omeprazole, esomeprazole, pantoprazole, lansoprazole. These are the little pills people take for acid reflux, heartburn, and stomach ulcers. And they work well for what they're designed to do, which is why hundreds of millions of prescriptions are written for them every year. But here's what most people, and frankly, even some doctors, and don't fully appreciate. Taking PP is long-term may be quietly destroying your kidneys. A groundbreaking study published in JAMA Internal Medicine in 2016 analyzed data from nearly 175,000 patients and found that people who regularly used PPIs had a 20 to 50% higher risk of developing chronic kidney disease compared to those who didn't take them. That's not a small number. That's not a statistical fluke. That is a significant, serious finding that every PPI user needs to know about. And the risk grew with longer use, meaning the longer you've been on these medications, the more danger your kidneys may be in right now. The exact mechanism isn't fully understood yet, but researchers believe PPIs may contribute to a condition called interstitial nephritis, essentially inflammation inside the kidney tissue itself. Over time, this inflammation scars the kidney, reducing its ability to filter your blood properly. And because this process is slow and largely symptom-free, most people have absolutely no idea it's happening. They keep refilling their PPI prescription month after month, year after year, never suspecting that their heartburn medication might be chipping away at their kidney function in the background. What's particularly worrying is how many seniors are on PPIs long-term when they were only ever meant to be used for a few weeks at a time. A review published by the American Gastroenterological Association found that a large proportion of patients who are prescribed PP is continued taking them far beyond the recommended duration, often simply because no one ever tells them to stop. If you've been on a PPI for more than 8 weeks and your doctor hasn't recently reviewed whether you still need it, that is a conversation worth having today. There may be gentler, less risky ways to manage your acid issues, including dietary changes and over-the-counter antacids for short-term relief that could protect your kidneys while still keeping your stomach comfortable. Your kidneys are worth that conversation. The next category might surprise you because these are medications that doctors prescribe precisely to help you feel better. Antibiotics and diuretics, sometimes called water pills. Now, to be clear, not all antibiotics are harmful to your kidneys. Most are perfectly fine, but there is a specific class of antibiotics that has been repeatedly flagged by nephrologists as carrying a real risk of kidney damage, and these include aminoglycosides like gentamicin, as well as certain types of sulfonamide antibiotics. These are used to treat serious infections, and they're often necessary, but if you're a senior and you're prescribed them, your kidney function absolutely needs to be monitored closely throughout your treatment. A 2021 review published in the Clinical Journal of the American Society of Nephrology highlighted that aminoglycoside antibiotics are among the most common drug-induced causes of acute kidney injury in hospitalized patients, with older adults at significantly higher risk due to their naturally reduced kidney reserve. The drug builds up in the kidney tissue itself, causing direct toxic damage to the cells that do the actual filtering work. And once those cells are damaged, they don't always come back. This is why if you're ever prescribed one of these antibiotics, whether in a hospital setting or not, you should ask your doctor whether regular kidney function tests will be part of your monitoring plan. Diuretics and gastri, water pills like furosemide and hydrochlorothiazide are another concern. These are commonly prescribed for high blood pressure and heart failure, and they genuinely help manage fluid buildup in the body. But if the dose is too high, or if you become even mildly dehydrated while taking them, your kidneys can be placed under serious stress. Dehydration reduces blood flow to the kidneys, and when combined with a diuretic that's already forcing your body to excrete fluid, the kidneys can go into a state of acute injury very quickly. Seniors are especially vulnerable because the sense of thirst naturally diminishes with age, making it easy to become dehydrated without ever feeling particularly thirsty. And there's one more medication in this category that deserves a special mention: contrast dye, used during CT scans and certain imaging procedures. If you've ever had a scan where a nurse injected a liquid into your arm just before the imaging began, you were given contrast dye. In most people, it passes through the body harmlessly, but in people with reduced kidney function, which includes most seniors to some degree, it can trigger a condition called contrast-induced nephropathy, A study published in Radiology found that this condition can cause sudden, severe kidney damage, particularly in people who weren't adequately hydrated beforehand. If you're scheduled for any imaging procedure that involves contrast dye, make sure your doctor knows your full kidney history and take steps to protect your kidneys during the procedure. We've covered 3 major pill categories so far, and now let's round out our list with 2 more that are especially common among seniors. The 4th type of medication to watch out for is certain blood pressure drugs, specifically a class called ACE inhibitors and ARBs, which include medications like lisinopril, enalapril, losartan, and valsartan. Now here's where things get a bit nuanced, because these drugs are actually prescribed to protect the kidneys in many patients with diabetes or high blood pressure. And for many people, they do exactly that. But, and this is a crucial but, in patients who already have significantly reduced kidney function or who have certain structural problems with the blood vessels supplying the kidneys, these same medications can actually accelerate kidney decline. This is why regular monitoring of your kidney function through blood and urine tests is absolutely essential if you're on any of these medications. The 5th medication category is one you might not expect at all: laxatives and antacids containing high levels of phosphate or magnesium. Many over-the-counter bowel prep products and certain antacids contain phosphate compounds that healthy kidneys normally filter and excrete easily, but in seniors with even mild kidney impairment, which research published in Kidney International in 2022 suggests affects well over 40% of adults over age 70, these products can cause a dangerous buildup of phosphate in the blood, leading to serious and sometimes irreversible kidney damage. These products are sold without a prescription, which gives many people the false impression that they must be completely safe. They can be, but not for everyone and not in every situation. Now for the part you've been waiting for, the 3 easy solutions that can make a real difference starting today. The first solution is to ask your doctor for a complete medication review at least once a year. Bring every pill, every supplement, and every over-the-counter product you take to your next appointment and ask your doctor to review the whole picture together. The goal is to identify any unnecessary medications and to check whether any of your current drugs could be harming your kidneys. The second solution is to get regular kidney function tests. A simple blood test measuring your creatinine levels and estimated GFR, glomerular filtration rate, can tell you and your doctor a great deal about how well your kidneys are working. Many kidney problems caught early can be slowed or even reversed. Caught late, your options become far more limited. Ask your doctor to add kidney function to your routine annual blood work if it isn't already there. And the third solution, the one most people overlook, is hydration. Drinking enough water every single day is one of the most powerful and completely free things you can do to protect your kidneys. Your kidneys need water to flush out the waste products and drug metabolites that build up in your bloodstream. When you're dehydrated, those compounds become concentrated and more damaging. Aim for at least 6 to 8 glasses of water a day and more when it's hot or when you're physically active. It sounds almost too simple to be true, but your nephrologist will tell you hydration is kidney medicine. So there you have it. 5 types of pills that can harm your kidneys after age 60 and 3 practical solutions to help you protect them. The most important thing I want you to take away from today is this: you are not powerless. Your kidneys have been quietly working for you every single day of your life, and now it's your turn to work for them. A medication review with your doctor, regular kidney function tests, and something as simple as drinking more water could genuinely change the course of your health. Don't let another year go by without having this conversation with your healthcare provider. Print out this information if you need to. Share this video with someone you love, a parent, a spouse, a friend, because this is exactly the kind of knowledge that saves lives. Every single person watching this deserves to have the full picture of what's going into their body and what it's doing once it gets there. If this video helped you today, please give it a thumbs up. It truly helps more people find this information when they need it most. And if you're not subscribed yet, hit that subscribe button and ring the bell, because we share important research-backed health content for seniors every single week. Leave a comment below and tell me, were you aware of any of these kidney risks before today? I read every single comment, and I would genuinely love to hear from you. Your kidneys have been taking care of you for over 60 years. It's time to return the favor.